hospital and you're going over to the healthcare center, you know, our staff over there are very aware that you're coming. They may not know the exact time you're coming, but they're very aware that you're coming. So, you know, the communication sometimes is communication. Sometimes the hospital communication with us is not always the best, but we have a pretty good idea where our residents are. We follow them as to what's going on with them in the hospital, and so we have a really good idea when they're coming back to the community. What surprises us sometimes is the hospital sends them back without us knowing, so that can be an issue, and so we have to work with the hospitals on that. But, you know, I hear you. We'll keep trying to improve that process.
We have United Healthcare Advantage, and so it sounds like we shouldn't get sick for 30 days. Are you going to notify us when all of that's approved? Because we don't have any choice on our insurance. That's mandated by my retirement system.
Yeah. Yes, ma'am. We had received an email last week that there was verbal approval, but as Stephanie said, we're waiting for the official letter to come in. So our hope is that all of this is completely finalized before March 1, but we will definitely keep you posted.
Okay, thank you.
Yes, ma'am.
If you do get sick between now and then,
I'm coming to your office.
Come into my office, okay? I'll help you out. No, I mean, you know, you can still use your insurance. It's just out of network. It's not in network. And I know that's not ideal, but you could.
With the insurance companies that you deal with, United Healthcare, then it says commercial only. What is that? And my specific question is, we have Government Employees Hospital Association, and that's run by United Healthcare. Are we covered?
Yes. I'm not completely certain about the question, but yes, okay. And Stephanie knows more about the insurance than the three of us do. I just know that United Healthcare, Medicare, is the only one that's considered to be out of network right now, but we had received verbal approval, but we're waiting on the final letter. Does that help? Thanks, sir. Me too.
My question has to do with medical records. I need to understand again what's going to happen to my medical records. I have the advantage of medical records scattered around about 4 different hospitals. That's an advantage, I guess. But what will happen to the medical records, and how do I get access to them?
You will still have your portal that is set up with your various specialists. So my chart or, different various portals with the different health care systems. You will still have that. We will be able to see that. As far as your primary care note from Amber or Dr. Blake, that's going to be inside of GeriMed. We do have a portal into GeriMed if you want one more portal. But as of right now, the information in that portal is pretty minimal. If you need a note, say Dr. Blake or Amber saw you and you need to take that note to your specialist, we're happy to print that off to give to take to you, or we can fax it over there to the specialist. If you need something, we will make sure you have a copy. No, sir. Well, we do have that portal. As of right now, the full progress note is not going inside of that portal. Yes, ma'am.
Okay, I guess just that portal piece. Oh, I'm sorry. That portal piece. Right now, we can look at our WAKE portal, and we can see the doctor's notes following our visit. Will that be a goal of yours to provide on your portal?
Yes, ma'am.
Okay.
Absolutely.
And I just want to beat this insurance thing to death one more time. You have a list here of insurers that you have given us, and it says contracted payers. So if there's nothing on the following line of the insurance company, that means you have the written approval, and we're good to go.
Yes, ma'am.
Okay.
The only hiccup right now is the United Healthcare Medicare.
Okay,
Yes,
thank
ma'am.
you.
Yes, ma'am.
So I have a question about the blood work. Currently, when I get my blood drawn here for my annual physical, I have other specialists that have other tests. And currently, Amber can see inside Wake Forest or Cone Health System and see the tests that they have also ordered. And so I don't have to get multiple sticks for my blood draw. They can run all those tests at one time. Is that possible to do that here?
Yes, yes, she will still be able to see all of that.
Oh,
So
wonderful.
that process shouldn't
So
change.
she can see what my specialists want, and
Yes,
I can
ma'am.
get my blood done at the same
Yes, ma'am.
time. Good, wonderful.
If you need extra
Okay.
sticks, let me know.
So,
We don't want to stick her erection, believe me.
Okay, I think you may have just covered one of my questions about the lab work. My question, though, is if I have an order for labs from, say, Atrium, can you folks do those labs for me?
Yes, ma'am. You're currently getting that now, right? Yes,
Exactly,
ma'am. That will
yes.
stay the same.
Good. Okay.
Yes,
The
ma'am.
other thing is, right now, Amber is my primary care provider. Will that need to change to Dr. Blake?
Amber can stay your primary care, absolutely.
that's fine.
Yes, yep.
My question is, will there be a clinic between now and March the 4th? I mean, would we see you, or would we see Wake Forest Baptist?
Now, we have, the current situation we have now runs until the end of February, beginning of March. So there'll be a transition time of a couple days where Curana's taking over and Wake is backing out. But no, we'll have full coverage in the clinic all the way through. The transition should be pretty seamless for you.
Regarding the lab work again, excuse me, if I have lab work done by Cone, and that appears on my portal, you said you can see that lab work. Is the reverse also true? If you do lab work here for me for an annual physical, can my nephrologist at Cone see that as well?
No, sir.
No.
He would not be able to see that. So, again, we would be happy to print that for you to take to the visit, but unfortunately, he wouldn't be able to see it.
Okay, I'm just curious. Are you all just going to handle River Landing? Or is the whole Bright Spire family going to be in it? Is Wellspring going to be in it? It's a financial entity and makes a difference with finances, and I know that that merger is dealing with
The answer is
purchasing and all
no,
that kind of
no, no.
no.
This is River Landing only at this point. Now, we
At
currently.
this point is what you said?
Yeah, because the caveat to that is that, we share, maybe most of you don't know this, we share our current medical director with Penny Byrne, who is not affiliated with us, and that might continue. Dr. Blake might end up working also with Penny Byrne like Dr. Piazza has done right now. So that's the only caveat. Otherwise, it's just all River Landing.
Right now, I'm able to go through my Wake Health and text or send a message to Amber. It's a non-medical or non-urgent question, and she gets back to me. Will there be something available like that? I can do it any time of day. I can just type in a question, and she gets
Yes,
back to
ma'am.
me.
On that GeriMed portal for our electronic health record, there is a way that you can send a message. Yes, ma'am.
Yes, I'm looking through this folder, and there's a new patient health history, there's a treatment consent, and there's a family history. Would you like us to fill those out and get them back to you?
The main one is the consent to treat. The consent to treat, and they're in the packets. That is the one that we will need to have before Amber or Dr. Blake would technically be allowed to treat you.
So I think with the couples, you only got one packet coming in. So we'll provide extra copies for the consent forms, and if we need to do the histories as well, we'll have those for you too. We'll have them either in the clinic, or I think Cindy said she's going to put them on Care Merge so that you have access to all that.
My question is, if I've been here a long time, and I have a primary care physician that I've been seeing for these many years, originally when I arrived here, she could request a blood that you folks in the clinic draw my blood, and she could see, or you would send her the report of the when you got it back from your lab that you sent it off to, you would send it on to her.
Yes, ma'am.
Is that going to be available now? It was not prior. In other words, if I go to my doctor twice a year, and
So you're just thinking about using the clinic specifically for a blood draw?
for blood draw or for blood pressure, or instead of me having to get out and drive 20 miles to a lab to get my blood drawn.
Can she just come and get a blood draw? That is a great question. I'm not 100% certain. For the blood pressure, yes. You can have like a nurse visit, where you check your blood pressure check, or if there's like a skin issue or something like that. I don't see why there would be a problem with just getting your labs
but
drawn.
There's always been this big problem ever since the last
let me
folks took over.
let me check on that for you.
All
We'll
right,
let Tom know. Yes,
I very
ma'am.
much appreciate that.
Yes, ma'am.
Thank you.
Yeah, you can write that down. You writing this stuff down, Kim? Because they're going to need to be able to bill lab services.
I have insurance that no one else here has. It's called Samba. How do I find out if you'll accept it or not?
We will check on that too.
Okay, it's SAMBA.
Okay. Kimmy's making me a list. Oh, yay!
Amber, you're one of us now. Come and have a cigarette.
Yeah.
Have labs. She wants to have labs drawn.
That person's going
But
in.
we should be able to. We should be able to bill for labs.
Yeah, they ready.
Yeah.
Okay, I have United of Omaha Insurance. I don't see that on here.
Okay. We will write that one down too.
Today, when we pull the little cord, how's that going to be changed?
When you do what?
We pull the cord.
Pull the cord?
It has nothing to do with Curana. They don't respond to the cords. That's a nursing thing that our
gonna
nurse
do-
responds, and then our security team will respond.
Okay.
So that hasn't changed.
Hasn't changed.
Here you go.
Am I correct in assuming that my chart will not continue to be updated? That
It will be updated
Okay.
by any specialist that you see, but not by us.
Okay, so if I'm continuing to use Amber as my primary physician, I can no longer depend on my chart to be current?
From the PCP standpoint, yes, sir.
Can I answer that?
Yes.
So let me clarify just a little bit. So Epic is used with Novant Health and Cone and also Atrium. So that being said, they're the ones that put the updates out there. So since they're using a different software, that wouldn't necessarily get updated because we're not using the same software. We're not using Epic. With the charting, if you have, let's say, some need, you need a specialist, we would just send those, your chart over to that specialist so they're aware of what's going on. But it allows us to be able to see we're still able to see what the specialists are charting and what they have decided. Does that help?
I have CHAMP VA insurance. Does that need to go on your list? I have CHAMP VA insurance. Will that need to be put on your list?
They're adding it to the list now.
Thank you.
Okay, as far as charting, how will we know what your results are? It's helpful to see that chart on my chart because you get to see whatever Piazza or Amber concerns are and the,
Yes.
and the issues that they would like to follow up on.
Yes, so we have the portal in GeriMed, and that is something that they're working on expanding, and the lab results, and hopefully eventually full progress notes will be in there.
And I'll add that, you know, if we're not able to get that information to you as timely as you'd like it, I would suggest that we see you again. You know, if it's just for a lab follow-up visit, you know, let's connect again, get on the schedule, and we can talk specifically about those results and the plan of care regarding them.
Yeah, and I also want to just add, I have charts through Novant, through Cone, through Wake as well. So I have 3 different my charts that I have to juggle right now. Some of you probably are in the same boat. So I just picked up another one. So it's, you know, it's going to be fun. You know, we just have that many charts you have to go through. So, you know, as you do it now, as you kind of work your way through that system with the different my charts, you know, you're going to have to just have the Jerry, what's it called, Jerry what? GeriMed will just be another one.
So are we supposed to fill out these forms for you all to keep in your clinic, even though we are keeping our primary care providers
No,
in
no.
High Point, for example?
No, ma'am,
Just-
if you're not gonna be coming to the clinic, you're welcome to
Well-
just turn the packet, or
Well,
you're welcome
we
to
might
keep
be
the packet.
coming- We
Oh.
might be coming sometime, though, because we needed something immediate, but.
Oh, okay,
but
sure.
Urgent care.
Yes, ma'am.
So
And you
that
don't have
was
to
my-
turn it in today, just sometime before March 1st.
But, so you need the things filled out, even though we are retaining our own primary care doctors somewhere
The
else.
main form is the consent to treat. The other information is just very helpful for
Right.
Amber and Dr. Blake to have, but if you're already coming, they already have all that health history information.
Okay, well, if we haven't been coming to you for our primary care, we don't need to do it, or we do need to do it?
I'm not understanding your question, Kimmy.
If I'm keeping my primary care doctor as it is right now in High Point, but I sometimes may need to come to the clinic for something, do I still fill out the new papers?
Just the consent to treat is fine. Yes, ma'am.
Yes.
Okay. And you can just do that when you come to the clinic.
If you're maintaining your PCP as outside of the facility, that's fine. If you needed something urgently, we would just get you to sign a consent to treat when you came to the clinic. So you don't have to do it beforehand.
Okay, I'm a little confused. How many hours a week will Kimmy be in the clinic?
Permanently.
Okay, so we will have 2 full-time
Kimmy,
nurse
don't confuse her.
practitioners.
My name is actually Kimmy.
Yes.
Oh, darling, I'm not going to be the PCP in the
Okay,
clinic.
that was
We're
my
going to keep
confusion then.
Amber in the clinic.
Okay, okay.
That's
Okay,
the
that was my
plan.
confusion. I thought you were both going to
No,
be
ma'am.
here.
No, ma'am.
Okay,
No,
we
ma'am.
will have Amber full-time.
Yeah, Amber will be full-time in the clinic, and what we're tentatively thinking now, don't put it in stone, is that Dr. Blake will be in the clinic on Tuesday mornings, and Amber may round on like the memory care, but the clinic will be open those times up until 4 o'clock with a provider in there, but it'll be primarily Amber.
Kimmy, over here. I was with Duke Hospital, and my insurance is UMR through United Health. It's the Retirees Extended Care.
No, we won't accept that one.
I didn't think you would. Thank you very much, Tom.
Thank you. I added it to the list.
Tom, this is more a question from you. I've been listening upstairs instead of joining you all here, but I didn't hear this question answered. Why is River Landing the only part of the Bright Spire family changing our providers?
Each one of the communities has a different setup right now. So we were the only ones that were with Wake to begin with. So we're the only ones that's changing because of Wake. So I will tell you that I won't mention any community names, but I've talked to 2 other communities that are not very happy with their current situation, and I have turned them on to Curana because I think they are a great solution for not just us, for any communities in our industry, because they specialize in our industry. And so I think that's going to be really good for us.
Yes, I was wondering what happens if Amber is unavailable on any given day for her own personal reasons.
That's when I go in. I'm going to take care of you at that point.
Can we request an alternative?
Yeah. Yes, the other nurse practitioner that's going to be rounding in healthcare for the nursing home and assisted living, we will be able to cross cover. So when Amber is out, she will be able to work some in the clinic, and then vice versa. When she takes a day, or we only allow 2 days off per year. Just kidding. When she takes some time off, then Amber will be able to go out there as well.
Would you add USAA to your list?
Surely.
Yes.
And also, if you don't mention your insurance company or you don't see it on the list, just find me after this and I will add it to the list. Once I get all the confirmations, I will send it over to Tom so he can do an email blast or something so everybody will know about their insurance companies.
So if for some reason it doesn't work out after you do your investigating and an insurance company is out of network or can't be on your list, what does that mean for us?
Yeah, you know, I've been with this group for 16 years now. I've never had a patient tell me that they didn't accept the insurance. Yeah, it would just be out of network. We could still see you, but you know, I know no one wants to pay the out of network cost, but we could still see you.
How does your company determine that an insurance is out of network?
Well,
is it that the insurance company refuses something for you?
I mean, there's I know like the insurance board, and they have a whole credentialing process. Yeah.
Why don't you mention about the number of residents that you serve and the fact that because of that, you know, you accept
I'm happy to give you names. I mean, so just to give you an idea, in North Carolina, we cover over 75 facilities. We're in 9 life plan communities. We're at Arbor Acres. We're at Aldersgate, Abernathy Laurels, Piedmont Crossing. We cover multiple nursing homes and assisted living. So we're big. You know, the only hiccup that I know about is this United Healthcare Medicare, but again, we've gotten the verbal approval that will be finalized. So I would just have a very hard time imagining that these other smaller ones, even though they're not listed on there, that they're going to be out of network.
So when you list Humana, does that cover state of North Carolina, Humana?
You know, I cannot speak fully to insurance. I'm sorry, guys. We will get all this information for you, though, and let Tom know.
Okay. So if you would add that to the list,
yes,
please.
Yes, ma'am.
Is River Landing the largest community that you have?
I mean, some of these others, we have a clinic with hundreds and hundreds of patients, so I wouldn't necessarily say the largest.
But the best.
But the best.
Yeah.
Yes.
I think we may be able to take one more question. Meredith Davis lives at Myrtle Beach. Poor her. So she's got to drive, she's got a 4-hour drive. Does anybody have any other burning questions right now?
Just real quickly, we have a therapy group here called Trinity, which is a separate entity from River Landing. Are they still in your network? That's
Yes. Well, we will still be able to refer you to therapy and work with them and do the referrals. They would be the ones to bill your insurance. Trinity would.
How about a hand for the Curana folks over here? If you want to, come on up. There's still some freebies left. There is